Today, we're jumping straight into part 2 of our must know nursing terms, and I'll be sharing another 25 common words or terms you need to know as a new nurse or a nursing student to help you navigate clinical practice with confidence and improve your communication with patients and colleagues. If you haven't watched part 1 yet, be sure to check it out. Hello, welcome back to my channel. If you're new here, my name is Diana and I'm a public health professional currently specializing in mental health nursing. On this channel, I make videos about mental health awareness, general health and nursing topics, and provide insights for navigating the challenges of nursing school. If these topics are of interest to you, go on and hit the subscribe button and turn on the bell notifications so that you don't miss out on the valuable content I put out on this channel. And to my returning subscribers, thank you so much for your love and support. Let's jump right in. First on our list is ECG. This stands for electrocardiogram. An ECG records the electrical activity of the heart and helps detect abnormalities like arrhythmias, coronary heart disease, or heart attacks. It is usually quick and painless and would normally be requested by a doctor who feels a patient might have a problem with their heart. Next is cyanosis. This refers to a bluish discoloration of the skin due to lack of oxygen. Cyanosis is usually more noticeable in areas with thin skin, such as the lips and fingertips or nail beds, and is indicative of serious health issues that require medical attention. The next word is anaphylaxis. Anaphylaxis is a severe, life-threatening allergic reaction that requires immediate medical attention. Symptoms include skin reactions such as itching and hives, swelling of the throat and tongue, difficulty breathing, wheezing, which is noisy breathing, low blood pressure, cyanosis, shock, and so on. Next is BM. Depending on the context in which it is used, BM can refer to either blood glucose monitoring or bowel movements, that is, passing of stool. So you can hear something like the patient's BM is 4.5 millimoles per liter, which is within the normal range, or the patient hasn't had a BM in 2 days. Let's assess them for constipation. Next is edema. This is simply swelling caused by excess fluid retention. It is common in the ankle, feet, and legs, and could be a sign of heart, liver, or kidney issues. The next common word or term is incontinence. This is the inability to control urination or bowel movements. Patients may be incontinent of urine, in which case it is referred to as urinary incontinence, or they may be incontinent of feces, in which case it is referred to as fecal incontinence. Next, we've got BMI, which stands for body mass index. This is a measure of body fat based on height and weight. Next is sepsis. Sepsis is a potentially life-threatening condition where the body responds improperly to infection, causing injury to its own tissues and organs. What happens in sepsis is that the immune system overreacts, leading to widespread inflammation in the body. Common symptoms of sepsis include slurred speech or confusion, extreme shivering or muscle pain, mottled or discolored skin, passing no urine in a day, and severe breathlessness. And early recognition and prompt treatment are crucial for survival. The next term is PEG, which stands for percutaneous endoscopic gastrostomy. This is a feeding tube inserted into the stomach for patients who can't eat orally. The next word is pallor. This is an unusual paleness of the skin, often due to anemia or poor blood circulation. Before we continue, I just want to take a moment to thank all of you for your amazing support on this channel. If you're finding my content helpful and want access to exclusive perks, consider joining my channel memberships. Members get access to exclusive perks such as member shoutouts, early access to new videos, members only live streams, and more personalized content. Click the join button below to find out more. Next, we've got a defibrillator. You might commonly hear it called a defib for short. A defibrillator is a life-saving emergency medical equipment that gives a high-energy shock to restart the heart of someone who is in cardiac arrest in order to restore a normal heart rhythm. The next word is tremor. A tremor is an involuntary, rhythmic shaking of a body part which can range from mild to severe and may be constant or intermittent. The next word is sedation. Sedation is the use of medication to relax or calm a patient. It can be used before certain procedures such as surgeries to help the patient remain comfortable, or in mental health settings to calm a patient. Next, we've got UTI, meaning urinary tract infection. This is an infection in the urinary system, often causing pain and frequent urination. The next word is delirium. This is a sudden change in mental status, causing confusion and agitation, often due to infections such as a UTI or medication. It usually develops suddenly and is often associated with older age, but can actually affect people of all ages. Next on our list is crepitus. This is a sensation or noise felt under the skin, such as cracking, popping, or clicking when you move a joint, often due to trapped air. It can be harmless or a sign of an injury or condition such as arthritis or tendonitis. Next, we've got FBC or CBC, meaning full blood count or complete blood count. These are two terms for the same laboratory blood test, which provides information about different components of the blood, like red and white blood cells. It is one of the most common blood tests. Next, we've got hyper and hypotension. Hypertension is high blood pressure, while hypotension is low blood pressure. By textbook standards, the normal blood pressure is 120/80 millimeters of mercury. While this is the standard, different patients or individuals have their baselines, so anything significantly higher or lower than a patient's baseline would be considered high or low blood pressure for them. The next word is a pressure ulcer. This is skin breakdown due to prolonged pressure, commonly in immobile patients. Therefore, patients who are immobile need to be repositioned from time to time to prevent pressure ulcers. Next, we've got RR, an abbreviation meaning respiratory rate, which is the number of breaths per minute, and the normal range is between 12 to 20. Moving on, we've got the term ambulate, meaning to walk or move around. For example, you may be asked to ambulate a patient post-op to prevent blood clots. Next, we've got the terms IM/IV, meaning intramuscular and intravenous. These are just ways of administering medications. IM medications go into the muscle, while IV medications go into the vein. For example, pain medications can be given IM, but antibiotics will be IV for faster absorption. Next, we've got the word seizure, which is a sudden, uncontrolled electrical disturbance in the brain, which can lead to changes in behavior, movement, and level of consciousness. The most recognizable symptoms of seizures are uncontrollable movements or convulsions and temporary loss of consciousness. Next, we've got proteinuria, which is presence of excess protein in the urine, suggestive of illness. And last but not least, we've got the terms prone and supine. Prone means lying face down, while supine means lying on the back. These terms are used in medical and anatomical contexts to precisely describe a body position. And there you have it, another set of 25 common words or terms that every new nurse or nursing student needs to know before stepping into any healthcare setting. I hope you found this video valuable. If you did, please give this video a like, share, and subscribe to my channel for more nursing tips and insights. And once again, please, if you haven't checked out part 1, don't forget to check it out. And do let me know in the comments, would you like a part 3? Thank you so much for watching, and I'll see you in the next video. Bye.